Thank you for joining me today for Rural Health Resources. My name is Sarah Levin-Lederer, and I'm an Outreach and Education Coordinator for the network of the National Library of Medicine Region 7. Today, that is the day that this class is being taught live and recorded, November 21st, 2024 is Rural Health Day. So we are happy and excited to be highlighting these resources today. So before I get into sort of the full presentation, I wanted to start by letting you know that throughout November, NNLM has been highlighting rural health resources through partner programming. So partners have spoken on things that they have done in their area. This is the last in the series, but all of the classes have been recorded. And so if any of these interest you, you can always go back and check the recordings. I think many of you may have previously taken classes with us, but just for folks who may be new to our trainings and classes, a quick introduction to who we are at the network. The National Institutes of Health is the nation's leading medical research agency. The National Library of Medicine is an institute at the NIH. NLM is the world's largest biomedical library, which provides information resources such as PubMed, clinicaltrials.gov, and Medline Plus. And NLM is the network of the National Library of Medicine and is the outreach arm for the National Library of Medicine. The network operates out of 7 regional medical libraries, or RMLs. The RMLs offer training and funding opportunities to support equal access to biomedical information. The goal of NNLM is to advance the progress of medicine and improve public health by providing U.S. health professionals with equal access to biomedical information and improving individuals' access to information to enable them to make informed decisions about their health. So this is our regional structure. I am with Region 7, so I serve New England and New York. But wherever you are joining us from today, there is a region that covers you as well. So as I mentioned, we have been focused on rural health throughout the month of November. So we have a couple of other resources that can help you and your communities that you serve better understand and learn about rural health. One of those is the NNLM Reading Club, whose November selections feature 3 titles on rural health. The Reading Club serves to help libraries with health literacy outreach and engagement through reading. It's similar to a book club with book selections and guides related to health topics. On the NNLM Reading Club page, you are able to see recommended books by health topic, download discussion guides, and promotional materials. So every month there's a different topic, and this month was rural health. So a few more bullet points on what we do as a network. We focus on 3 primary areas: training, network access, and funding. And we offer access to NNLM network of libraries and other organizations, free trainings to librarians, health professionals, and the general public, and funding for health-related projects such as health information outreach, health equity, and the digital divide. And then finally, before we get into the presentation for today, we have developed a rural health resource guide to highlight some of the resources that we're talking about today, as well as highlighting some of the resources that partners talked about in their presentations throughout the month of November. So with all of that, as I mentioned, we're closing out November with this rural health resources class, and we'll be covering the objectives: describe current demographic trends in rural America, resources to download data sets and visualizations for rural health resources, and ways to find information on health conditions, demographic groups, and social issues. So before we get into all of that, I'd like everybody to take a moment to imagine rural. What does it look like? What industries do you think of? what are the challenges and successes? And so this is just for you, when you think about rural, what do you see? What do you think about? And so I wanted to start with those thoughts because what I think of when I think of rural here in New England may be very different from what you picture. And so we're going to be taking a very broad view, a very national view on rural today, but I want you to sort of keep in the back of your mind what you were thinking about to sort of put this broad view into perspective and into that local context. So we will be talking about rural health in today's class, but really wanted to talk about sort of the context of rural health as well. And so depending on the definition, around 15 to 20% of people in the United States live in rural areas. There are many different reasons why people live in rural communities: lower cost of living and a slower pace of life. Rural areas are less crowded and can offer more privacy. You may live in a rural area so that you can be near your family and friends. But there are also challenges to living in rural communities when it comes to taking care of your health. So compared to folks who live in urban areas, folks in rural communities are not able to get to a hospital quickly in an emergency, need to travel long distances to get routine checkups and screenings, and have less access to dentists, and certain specialists might not even be available. So folks in rural communities have higher rates of certain types of cancer from exposure to chemicals used in farming as well. So in your experience, in your lives, in your work, what impacts health in rural communities? And so if you want to throw some thoughts into the chat, that would be a really great place to start. Access to care. Yeah, we definitely hear that one from partners as well. Transportation, and also how that access to care, transportation. Yep. Family practice physicians from a Canadian chiming in, staffing issues. That's definitely one we're hearing more about. Broadband, lack of resources, financial disparities, language barriers, oral health, urban biases for funding, educational opportunities, difficulty connecting to community if you're new there, food desert, transportation again, and the access to care. Yeah, these are definitely, medical desert, yeah, in Alaska. So there's also different rates of how far folks have to travel. Pharmacy deserts, varying environments, farming, mining, fishing. Yeah, definitely.
And Sarah, just to, someone said very early on was access to maternal care. So not even having a labor and delivery department.
Yeah, absolutely. Specialist care, and especially around maternity health or maternal health, is one that we've heard a lot. Closest hospital to us is about an hour drive. Yep. So I think we touched on a lot of these. Oh, no walk-in clinics. Yep. So transportation issues, lack of broadband, and that connectivity, lack of insurance, lack of providers, and then some of the environmental hazards and occupational hazards also came up, uh, excuse me, as well. So, and these are all things we've heard from partners as well, and we've heard in past classes. These are also things that you'll often see on reports from the CDC and some of the other federal agencies. So before we get into some of the live demos, some of the resources and things like that, I wanted to take a moment and step back and actually define rural. So this is the slide. So I want to start by saying that this is very complicated, and this slide has a lot of information on it. This slide is not to have you memorize definitions of rural, but it illustrates three things. Rural is defined in contrast to urban. So when you look at a lot of the definitions, what's really being defined is urban, and then everything else is rural. Two, there are different definitions of urban/rural, even when you're looking at federal agencies. So the two that are illustrated here, the Office of Management and Budget and the Census Bureau, are the ones that you may see most often, but they also are not the only ones. And you also need to be aware that some things done on the state level may have their own definition as well. And three, the definitions are not clear cut and may include or exclude areas that don't always make sense. For example, the census definition is done at the census block or block group level and doesn't follow city or county boundaries. So sometimes areas that in a lived experience you might consider suburban will be counted in that situation. The OMB definition is done at the county level. So some areas that people might consider rural, if you live there, are in urban counties and are not counted. So final thought on the definitions. The OMB definition means that 46 million people live in rural areas, so about 15%. But the census definition accounts for 66 million people, or just under 20%. So because definitions are often the basis for cutoffs for programs and grants, check with any organization you're working with to learn about their specific criteria. So now that we have that very vague understanding about how we define rural, we do need to know that there are folks who do research, and so they may be using different one of these definitions or another one. You know, you'd want to be looking for that when you read the reports and things like that. But a really good source for some studies on rural communities is through the United States Department of Agriculture's Economic Research Service, or ERS. And so this is a good source of charts and reports that include but go beyond farming data. And so we're actually going to look at this specifically when we go live. But just to be aware that this is a great resource if you're looking for some background information on rural. One of the things that the ERS does every year is put out Rural at a Glance. This report is put out in November every year. So we're using last year's report for today's session. But if you do go on the USDA's website, the 2024 report is live. So in terms of the takeaways from last year's Rural America at a Glance, one, rural population is actually growing following 10 years of negative or near zero net growth rates. Population growth is primarily from domestic migration, in-migration from other parts of the country, but the percent of international migration to rural areas has risen slightly as well. Point two, rural poverty has declined over the last 15 years in most, but not all, rural counties. The declines are modest, though. Although rural poverty has declined, housing insecurity is a big issue for low-income renters, especially, and is particularly acute problem for American Indian or Alaska Native and Hispanic households. And then three, rural employment has almost recovered to pre-pandemic levels and is showing modest growth. And the modest growth is similar to pre-pandemic employment growth as well. So then when we're looking at the demographics of rural, there was an interesting report put out by the University of New Hampshire Carsey School of Public Policy, September 2022, entitled Growing Racial Diversity in Rural America, Results from the 2020 Census. And according to the brief, rural America is becoming more diverse. And so this chart on this slide is demonstrating the fact that the under 18, so children has a higher percentage of folks from racial and ethnic minority groups, whereas the over 18 adult population is still overwhelmingly white. And I actually wanted to quote from the report itself because it puts it into good number context. Nearly 1/3 of all rural children, so 32.5%, come from racial or ethnic minority populations compared to 21.8% in 2010. In contrast, 21.6% of the adult non-metro population are members of a racial or ethnic minority. This growing child diversity is the result of two diverging trends. Over the past decade, the rural minority child population has grown by 7.4%, while the non-Hispanic white child population has declined by 12.7%. The contrasting patterns are in part because of a larger share of the white population having aged beyond childbearing age. And so then one final look at demographics. To take a really quick look at the intersection of poverty and race slash ethnicity. This chart is an example of the charts that are available from the Economic Research Service. And the title of this chart is Poverty Rates by Select Racial and Ethnic Groups, Residents, meaning the chart shows a comparison of non-metro and metro poverty rates by race, ethnicity. And so I'd really appreciate folks to take a second to look at the chart, and then in the chat, let us know what you see. So there is more rural poverty. Rural overall has higher poverty rates, which is true across race, ethnicity. But one of the things that the chart does demonstrate is that communities of color are having higher disparities in rural areas. So although there is a divide, that the rural line is higher across the board, the gap is higher for folks in the racial and ethnic minority groups. So we talked about some of the issues early on that make rural health slightly more vulnerable, some of the things that you're seeing in your own community. And so here's sort of that divide between the actual numbers between metro and non-metro for some of the vulnerability scores. So underlying health problems, older adult population, lacking health insurance, and then we did discuss the distance to hospitals with intensive care units. So put some of those things that we talked about into actual numbers. And then one of the things that we talked about is this access to healthcare. And is an issue that we've had come up on multiple slides. And one of the things is that part of that is that things are farther apart in general, but there's also the issue of resources closing. So why are rural health hospitals closing? What you see here on the slide is according to an American Hospital Association report from September 2022, in that 10-year 2010 to 2020 span, 136 rural hospitals closed due to low reimbursement rates, staffing shortages, low patient volumes, regulatory barriers, and expenses for labor, drugs, supplies, and equipment. The Centers for Medicare and Medicaid are attempting to address this trend with a relatively new designation of rural emergency hospitals, which became effective in January 2023. The designation keeps emergency departments open in rural counties, but requires hospitals to stop inpatient services. So as of an October 2024 report by the Rural Health Redesign Center, which is the technical assistance center for hospitals who are interested in undergoing this change, 30 hospitals have adopted the rural emergency hospital designation and made the transition. So I don't know if anybody lives in an area where their hospital has made this change, but if you're interested in sharing, that would be really interesting in the chat. So we have covered some of the demographic trends in rural America around race, ethnicity, poverty, and some of the hospital closures, the access to services, which is class objective number 1. And so we're going to move on to objective number 2, where do you find this information if you need it for program planning or for writing a grant. And so I've mentioned the USDA Economic Research Services, and we are going to see that when we go live. I do want to introduce one other resource, which is the Rural Health Information Hub. The hub is funded by the Federal Office of Rural Health Policy. This resource specifically looks at rural health information. So they dub themselves your first stop for rural health information, and is a great source for exploring some of the topics that we've already talked about and that we saw when we were talking about some of the things that you see in your own communities. So things like issues of transportation, broadband, lack of providers. So some of these things that aren't necessarily just specific to, health in terms of disease and conditions, but also related to some of the social determinants of health. So then our third objective is the find information on health conditions, specifically for demographic groups and on specific social issues. Again, we will take a deeper look at these when we go live shortly, but just to introduce them real quick. We have Medline Plus. Medline Plus is health information in plain language for patients and caregivers. Medline Plus has information on diseases and conditions, as well as health information for specific demographic groups. The information is available in English and in Spanish. And then when we switch to the live demonstration, we'll look at best practices for finding information on Medline Plus and some of the other features it has to offer. And then the CDC also has a rural health information hub. If we have time to look at this in the live demo, we will, but I just wanted to make sure that people were aware of it. It has topics in rural health policy briefs, success stories, and then also toolkits and communication kits for talking to communities and putting into practice some of the for addressing some of the health issues that rural communities are seeing. So with all of that, I am going to switch over to the live demo. We are definitely going to look at ERS and Medline Plus. If we have time, we'll also look at RAH Hub and the CDC website. Before I switch screens, are there any questions on that first section? Or as I switch screens, maybe that's a better way of putting it.
Sarah, this is Rebecca.
Mhm.
I just want to add that I updated the link on the handout that points to the, you had the 2023 report, the Rural America at a Glance. The handout now has the 2024 link on there. So if people have
Awesome.
downloaded it, you might want to re-download it. It's the exact same link that we put into chat, but it has the newest info.
That is awesome. Yeah, we like to have this class in honor of Rural Health Day, but the report comes out at roughly the same time for the same reason. So, want to make sure that you have the most up-to-date information. April, can you throw the link in the chat? Christine, okay, the handout link is in the chat again. Okay, so I have mentioned and we have seen a couple of graphs from the USDA Economic Research Service. A lot of what they have in terms of data sets, visualizations, things like that are related to agriculture because it is the U.S. Department of Agriculture, but recognizing that the folks that produce the food and who live in these areas are also part of that whole ecosystem. They also have information on and data on demographics and other social and health related issues. April has put the link to the ERS in chat, so if folks want to follow along, they're free to do that. So the first thing I want to point out is that right on the homepage, you have reports, data, charts, and maps. So right away you can say, I'm looking for a report, I'm looking for a data set, I'm looking for something that's been visualized as a chart, or I'm looking for something that's been mapped out. Or you can come up to the topics, and again, you can see that a lot of them are related to agriculture, to farming, but you can also see that there's the food choices and health, or we're going to come all the way down here to the rural economy and population, because this is where you'd find a lot of things we've been talking about today. So if we click on the topic, it gives a really nice overview. So, business and industry, employment, education, natural amenities, population and migration, some more information about rural classifications, rural poverty and well-being. And then if we look at along the sides, we also have these links again to the reports that fall under this topic. So Amber Waves article, Amber Waves is their sort of magazine. So if you're looking for more newsy type articles on topics, you can check that out. And then data, and then some of the interrelated topics. So in this case, we are looking at rural economy and population. So some of the things that are related would be the farm economy, food and nutrition. So I'm going to go back down to the rural poverty and well-being, since that's a lot of what we talked about early on. And then if I click into this, again, it's continuing to be overviews of things, but it's getting more and more in depth. And we also start to see our charts. And so you can see that when you have the chart, you also have the chart data. So if you're really looking more for the data than for the visualization, this is a federally funded project. So you can take the chart and embed it to illustrate something that you might be talking about, or you can download a high resolution. So again, if you are trying to put together a program plan or writing a grant and you need to support what you're saying with some information about the demographics, in this case, we're looking at the poverty rates comparatively between metro and non-metro, and we can see that they fell sharply between 59 and 69 for both, and then are sort of paralleling each other at this point. Anyway, so you can also look again early on when I said think about your own area, you can find some information about, I live in New England, so we can look at what that looks like in the Northeast compared to other parts of the country. And then we also have some mapping tools. And so we can look at the poverty rates, and again, we can say all, and then we are talking about rural, so we can flip that over and look at that information for the rural areas. And so then we see the chart that we were looking at earlier as well. So then they also make sure that there's an understanding that everybody's sort of on the same page. So we have the region definitions, and then also where the data is coming from. So how is poverty defined, and then some fact sheets. So fair warning, I am going to scroll back to the top really fast. So if that sort of is not great, be aware. Here we go. Okay. So then across the top, we can also look. So that was the products or the topics. We can also look at the data products. And so it's the similar topics. And we can go down to the rural economy and population, but now we can look at specifically data and go deeper into those areas. So again, we have a lot of data on our agricultural things, and then we also can see that you have things very clearly labeled as a chart, as a file, as a map, as an app. And then we also have a way to filter that information on the side. So we have our topic, and then we can look at subtopics. We want to look at population and migration, because we talked about that a little bit earlier. We can filter it down and see what the chart gallery looks like. So this is all charts again, so you can. Oh, I did not think it did that. Okay. Sorry, folks. I thought I had a good example lined up, and now I am not finding the in-migration, out-migration information. Okay, let's try another one. So scroll back up really fast. And that. I always forget that that's a reset button and not a search button. So learn from that. It automatically filters when you pick something. It's not a search button, it's a reset button. Okay. So we can look at something like the road ruggedness, which is not the biggest thing related to the transportation issue that people were talking about, but it definitely is an issue. And so you can see that there's a data set there that you can, oh, nice. Thank you. I did not know that. There's a key shortcut in the chat, which is going to be very useful. So you can see that the data set is there to be downloaded and used. So I'm just going to click into one more just randomly so you can sort of get the idea of, so there's the overview, and then you have your charts. And again, you can use these charts to download and use to support any documents that you may be writing. So, okay. That is a very basic, broad overview of the economic research services at the USDA. Are there questions about any of this that I might be able to help with? And then I was just reminded that we should have enough time. So I'm going to flip over real quick to the Rural Health Information Hub. This is another place when we were talking about data that we can use to look at our specific areas and information about what's going on. Okay, just a quick note that there is somebody in the chat saying that Chico State University is looking to partner with rural areas in California around ag and farming. So if that's you, put some information into the chat. So RIH Hub is both, it's health focused, but it takes the broad view of health. So there is information about broadband, about transportation, about some of these other social determinants of health. And there's also, so you have your data explorer, and this is more of an all-on-one page. You can map out, depending on what you're looking for, what you're interested in, dates, you know, if you're looking to do some comparison, all of that. And then the information listed out specifically so you can find that more local information as well. And then also the chart gallery. So by topic, again, by state, looking for that more local information, and then by type. But the thing that I actually wanted to highlight here, because there's a lot of things that we could look at, case studies, you know, I talked about the visualization, about the states and topics information. I wanted to point out the Am I Rural tool. So back when we did our, you know, definition of rural, we saw that there is no one definition. And so you might qualify for one thing, but not qualify for something else when looking at your geographic area. And so this is an aggregator looking at multiple factors, and it will list out rural, different areas where you might be rural or not, depending on which definition, which program it's looking at. So I will admit right now that I do not live in a rural area. So if we want to demonstrate this, I would need somebody else's zip code. But you know, if somebody wants to throw a 7, 3. Okay. So this was the first one that I saw. And so it gives you the you know, mapped out location. And then it also, you have to actually click on, oh, here we go. Have to click on where it says run report. So it gives you, you know, the address, the longitude, the latitude, the map, and then the map. And then it gives you information about, you know, statistical area, which is a U.S. Census designation, whether or not it's located within an urban area. So information from the Office of Rural Health Policy. So it is not in a county or 2010 census tract that has been designated as rural. Frontier and remote area, the rural urban community area code. And so it lists out different designations and definitions. And then it gives you some examples of things that you may be eligible for. So in this case, not for the CMS Rural Health Clinics program, and then some information about shortages related to healthcare providers and some of the other definitions like medically underserved. So. Any questions about RIH Hub before we get more into Medline Plus and then close things out? So we looked at some of the places where you can get some data and download some data and find visualizations as well. So now to flip over to talk about where you can learn more about diseases, conditions, and demographics. So Medline Plus is a product of the National Library of Medicine and is health information in plain language. So this is designed for patients, their families, for the general public. And so across the top, you have health topics, drugs and supplements, genetics, medical tests, and medical encyclopedia, and similar information down there. And so then you can search Medline Plus the same way that you put information in a search bar. Is there a topic that anybody would like to see searched? Well, I see if there's any strong feelings about that. There's also a mention and a link in the chat that's RH Hub has a program planning section as well. So there's a link in the chat for folks who might be interested in that. So I saw pancreatic cancer first. So as you can see, the first thing is that it does start suggesting as you type. And so I can go down the list to pancreatic cancer. And so the first thing you'll see is this box. And so that box is telling us that there is a health topics page on this topic on Medline Plus. You also will see other results, and all of those results are clearly marked. National Library of Medicine, the health topics, the medical encyclopedia, or if it's a link off of Medline Plus, it's clearly marked to where it's going to go. So in this case, link number 4 is Johns Hopkins University Department of Pathology. If it's to an NIH institute, it'll have the little NIH logo. So one of the things is that we can see that this isn't just information contained within Medline Plus. It is also linking out to other resources for further information. And all of the links on Medline Plus have to conform to the same standards that the information on Medline Plus has. So plain language, scientifically rigorous, no advertising, free. So we can also filter results if we only want to look at, things within Medline Plus, so the health topics pages or the medical encyclopedia. If we only want to look for external links, if we only want to look for medical tests, genetics, drugs and supplements, or if we only want to look for information from other NIH institutes. And you can also refine by format. So if you're looking for a handout, you might want to say, I just want to look at what PDFs are available. So if we click then into the health topics page, I don't want to do your survey. You can see that you have different kinds of information. So right away we have our summary and our, start here. So our basic information, diagnostics and tests, prevention, treatments, living with, related issues, more specifics, genetics, research, clinical trials, journal articles. And then you also get down to some of the demographic information. So in this case, there's some information about childhood pancreatic cancer, and then you also have your handouts. So if I go back up, not all the way to the top, you also see on the right-hand side different ways to access other information. So cross-referenced information. The National Institute of Health, the Institute at the National Institutes of Health that covers the topic, related health topics, and then information in the medical encyclopedia. And so you can see that the health topics page is really more of an overview. Whereas if you clicked into the medical encyclopedia, it would be more of a full article. So health topics page for links, medical encyclopedia for fuller information. The other thing that I want to mention is that up on the right, top right-hand side underneath the search bar is the ways you can toggle between English and Spanish. So I can go ahead right away and flip everything into Spanish and then back again. Medline Plus is designed to be fully bilingual. So if they make one change on one side, they are working always to make the change on the other side as well. So there's that. If we're looking specifically for rural information, we can once again search. And so there is a health topics page specifically on rural health concerns. And then we can see some of the things. So the links within the article, discussion of telehealth. And then we can also see, linking out to the Rural Health Information Hub. Lots of links to the Rural Health Information Hub. Then National Library of Medicine and the NIH Institutes. Any questions about Medline Plus specifically? So we have about 10 minutes. We can take a look at the county health rankings, which is another source of data and information or data sources. We can also take a look at the CDC's rural health, or we can switch back, and if there are any questions folks need answered, this would be a good time for that. So a few folks in the chat are already keen users of Medline Plus, which is definitely something we like to hear. So we will be putting an evaluation link in at the end. It doesn't sound like anybody has any preferences for taking a look at county health rankings or the CDC public health or rural health page. So I'm going to switch back to...
Thanks for watching. This video was produced by the network of the National Library of Medicine. Select the circular channel icon to subscribe to our channel, or select a video thumbnail to watch another video from the channel.